It's about 8:30 p.m. Here, just outside of New York City, and we've just put our daughter, our 1.5-year-old daughter, down to sleep, and now have a couple of moments to reflect upon what my work has been like and what I've been thinking about and what's been keeping me up at night. Over the past few weeks, I've really been thinking a lot about what this means, this pandemic means, and sadly, all of the children that are going to suffer because their access to healthcare, basic child health services, and immunization services will be suspended. For example, there are still many outbreaks of vaccine preventable diseases. We don't see them so often here in developed countries, but in developing countries where MSF works, there are still measles epidemics. Measles killed over 140,000 kids in 2018, and it's still a grave problem in countries like the Democratic Republic of Congo, Nigeria, and many others where there are active measles epidemics happening. The Measles and Rubella Partnership has estimated that more than 117 million children in 37 countries will miss out on their chance to receive a measles vaccine because mass vaccination campaigns and other routine immunization services are going to be suspended. So about a month ago, the World Health Organization, rightly so, put out guidance on how to prepare for COVID-19 in the context of trying to continue routine immunization services. And understandably, it's with great precaution that you can continue vaccination services because they require people to come to a health facility and lots of people to gather. And mass vaccination campaigns are really a very important tool that we use to protect children's health. In many places where families can't access medical facilities, they can't access healthcare, holding big mass vaccination campaigns where for a couple of days the whole community comes, people walk there and bring their children to receive vaccinations, for example, against measles and other vaccine preventable diseases. But in many of those cases, those mass vaccination campaigns have been suspended and postponed because we need to avoid having people gather in big groups for COVID. Obviously, you need to take the necessary precautions to minimize the spread of the COVID-19 pandemic, but also you have to think about all these children that if they do get measles or if they do get diarrhea or other vaccine preventable diseases, don't have easy access to health care and will die. So I don't know how one makes those decisions, but I've been thinking a lot about it and this dilemma of how you choose between two very difficult decisions.